or call toll-free in Kokomo and Lafayette at 1-800-447-4463. Now, let's rejoin Party Line on 1570 AM and 96.9 FM WILO.
Welcome back to Party Line. Going to talk with Jennifer FitzPatrick in just one moment. Want to thank our sponsors. We've got a telecast online every morning at HoosierlandTV.com. Check it out right now. Thanks to the Farmers Bank, Jim's Heating and Air Conditioning, Schultz IGA, Home National Bank, Wilson Farm Market, ProBite Computer Sales and Service, Ardente Dental, and Slabby's Food and Freedom. And our Party Line sponsors are Hardesty Landscaping, ClintonCountyDailyNews.com, Johnny V's, Pepe's and Greek's Pizzeria, Simple Time Antiques, good morning, Michelle, Ivy Tech Community College, Milner Healthcare, also Encompass Credit Union, Susan Casper State Farm Insurance, and Welty Custom Exteriors. I'm Kevin Keith with WILO News Director Ken Hartman over there. Jennifer FitzPatrick on the phone. Jennifer has written a book called Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One. And Jennifer, we know right now there's a lot more stress on top of the stress that's normally there caring for a loved one. And good morning.
Good morning. Thanks so much for having me on. Yeah, there's so much stress for caregivers right now. I mean, I was just listening to your last segment, and with everything that's going on, you know, kids not being home, going to school, in some places, and you not being able to visit your loved one. I mean, there's just so much going on.
Jennifer, when did you publish this book? And the reason I'm asking is because I wound up being a caregiver for both my parents, both my grandparents, I should say. And there was a lot of difficulties in doing that. So I was wondering, when did you come out with your book on this?
Oh, actually about 2016.
Okay, I wish this had been out beforehand because I could have used a couple of tips.
I wrote Cruising Through Caregiving because, I've been in this field for, over 20 years, almost probably 30 years now. But I saw caregivers, family caregivers, grandchildren like yourself, adult kids, friends, they were giving up their whole life for caregiving, and I wanted to write a book where every single chapter was a different way to reduce the stress of caregiving.
And the one thing, at least from my perspective, my grandparents didn't understand that I had a job I had to do, and I was fortunate enough to have a job where I could get away to help them out a lot of times, but there were some times I simply couldn't do it, and that's when we started having my issues.
Right, and so many people that are caregivers are working caregivers, and right now with all these people working from home, that is becoming even more of a challenge because say the person, like you were talking about, your grandparents, if the person lives with you and you're actually home all the time now, a lot of people think, oh, well, that's great. Isn't that terrific? Well, in some ways, yes. In some ways, no. The person thinks you're available to them, that if they need a glass of water, you can get it for them. And so it's really important to know that when you're a working caregiver, if you're working from home during this time, employers have to remember this is not necessarily less stressful for a lot of individuals. They're home trying to homeschool kids. They've got, sometimes elderly parents at home. So, yeah, absolutely. That's definitely a challenge right now.
Is there, in your mind, a top one or two things that are really a major problem for caregivers when it comes to this situation?
For one, I would say I call it the martyr syndrome. So when people, and I have in Cruising Through Caregiving, there's an assessment to see if you're in martyr syndrome. But with martyr syndrome, it's when a caregiver thinks that they're the only one that can do everything. And we've probably all had an experience like that in our lives, that there's one person that says, I don't want help. I don't think anybody else can do it the way that I'm going to do. So they resist. So if friends and family try to offer assistance of any kind, they push it away. They balk at the idea of utilizing maybe some home care or at some point maybe looking at assisted living. So that to me is very dangerous because if one person is in that martyr syndrome, they're very at risk for burnout. And there's so many negative things that can happen with burnout. If it's just one person doing the care, it's not good for the caregiver, but it's also not good for the care recipient.
Right. Well, I know what happened in my situation is their son, which is my dad, they decided they did not want him to take care of him. They wanted me to take care of him because I basically lived with him most of my life. And so that's how I got it that way. But then the other thing I wanted to ask about this is that I was always told that when you put them in a nursing home for their own good, even though they'll never admit to that point, they will always wind up hating you the rest of your life. Do you find that to be true to this day?
No, I think it just depends on the situation. So in Cruising Through Caregiving, I write about the idea that there is not one way to be a good caregiver. There are dozens, hundreds of ways to be a good caregiver. There are times where moving your loved one to either a nursing home or an assisted living community is truly in their best interest. And I will tell you that there are a lot of people that recognize that. A lot of older adults, they're going to find that when they move somewhere, that in some ways sometimes they gain more independence. They're interacting with others, there's activities, they feel less dependent on a family member that is younger, like a grandson or, a child. So I think it depends. Are there some people that are just going to be so angry and so mad? Absolutely. But I have worked with countless older adults that said, you know what, yeah, it is time. It's time for me to move. It's time for a different kind of experience, because a lot of older adults, they don't want to put that kind of pressure on their kids, their grandkids, their family.
Well, I must be in the minority because mine had no problem putting me in that category.
Well, and that's definitely an issue. I mean, the thing about when you're taking care of somebody who's do you mind if I ask what kind of conditions your grandparents had? What was the issue with them?
They had, they've been gone now over 10 years, so I can speak rather freely on this now. He had diabetes, and she had Alzheimer's.
Oh,
and
that's a lot.
And they were in their 80s when I decided to make the move, because I probably did something maybe I shouldn't have, but I just got tired and just said, look, this is going to have to be the way, because I'm not going to do this. So you guys take your pick. I don't care. So they agreed to do that. Maybe I shouldn't have done it that way, but that's the way I approached it.
Well, I think that's actually I encourage that approach. So, and here's why, because what you did is really smart. Like, hey, listen, I love you guys, but I can't do this indefinitely. Mm-hmm. So we have to figure out a new plan. Is it your grandmother that had Alzheimer's?
Yeah, the grandmother had Alzheimer's, and my granddad had diabetes.
Yeah, so I think for her, she probably wasn't easy to reason with, right? Like, no. She didn't understand things that were happening. Your grandfather, on the other hand, he didn't have a cognitive problem, and so he could understand. And I think having a reasonable, rational conversation with that person and saying, look, we got to figure out a new way, and given that as a choice. Because here's the thing, like, older adults, I have a whole chapter in Cruising Through Caregiving. It's called Your Older Loved One is a Grown-Up, because people sometimes forget. We start treating them like kids. But here's the thing, like, you're a grown-up too, and you have to set those boundaries, and you hit your limit. You said, I can't do this anymore. So I actually applaud the way you handled it. You said, look, we have to figure out a new way. This is an option. And, because your grandfather, theoretically, he could have just taken care of himself and taken care of your grandmother. Or he could have said, let's bring help, paid help into the home. But I think you handled it in a really good way.
I'm glad. I appreciate that. I really do, because there's a lot of times I didn't feel that way. I guarantee
you start second guessing yourself.
The other thing I really want to know about this is that I know in dealing with things like Social Security and what you have to give and what you get to keep and all this other stuff, I found that very difficult to navigate, because it seemed like there was a different way of doing it regardless of who you talk to. Is that also a problem for people still to this day?
So this is my blanket advice to everybody. Go to an elder law attorney.
Okay.
You want to see somebody that has CELA after their name. And the way you can find somebody in your area is go to NAELA.org, N as in Nancy, AELA.org.
Okay.
And what you want to do is call up, and a lot of them will give you like a free 10-minute, 15-minute consultation to see if working together makes sense. And they will help you figure out all the money stuff and, applying for Medicaid if you need to at some point, and how to protect your assets legally and ethically. So people all the time will say, well, I talked to a lawyer. No. Did you talk to an elder law attorney? CELA.
Okay. Well, the other thing, and this was so funny because I tried to get them changed from private pay to other pay, and I went to the Social Security office, and they would ask because I had lost exactly what certain things that were needed, and they said, well, we can't give that to you. And I said, why? And they said, because it's a law. And I said, that's the silliest law on the planet, because I said, You let me sign their checks, write their names, do all that kind of business. Yet you won't give me something that's going to help us improve things. No, we don't. I said, you guys better get your stuff together because that's not quite right.
I'm telling you, if you talked with a good elder law attorney, what you're sharing is so common. I hear these comments and questions and frustrations all the time.
Okay, I'm glad I wasn't the only one.
You are certainly not. And for all your listeners, going to an elder law attorney, that is how you navigate the financial system with helping an older loved one.
And back then, elder law attorneys, I had never heard of the term back then.
Oh, they've been around for a while.
I know.
For sure. 10 years ago, for sure. Yeah.
Okay. But I'm just saying, I don't think I'd heard of, when this first started. How did you get involved with something like this? This is, I find incredibly interesting that, somebody got into this situation.
Oh, that's so nice of you. All right. So actually, I'm looking at the numbers. It's been 31 years because I worked in a nursing home when I was 16 years old, and I'm about to turn 47. So I worked in a nursing home, and I really, really enjoyed working with older adults. I went to college, grad school, worked in all kinds of different facets of healthcare, but always in some way related to older adults. And I think it's an area that, I'll tell you, for those people who have been displaced from their jobs, this is an area that is not going away. If you have any skills that you might have can be transferred. There are jobs in sales, in marketing, in hospitality, it's not just being a nurse or a social worker in this field. There's so many positions, so management. So keep in mind that if you're somebody that's listening and you've been displaced from your job, I bet you the senior living, the adult day, the home health agencies in your area, they're probably hiring right now.
Okay. In your mind, is this field getting better, or where do you think it's at right now?
Where do I think the field is right now?
Yeah,
we are
caregiving.
This field is so it's. I think this is a time of where we're going to see a lot of creative innovation, because obviously the nursing home model is not working the way it is. People are so surprised with the numbers of nursing home residents that got sick and that had COVID and the deaths. I was absolutely not surprised by those numbers. There are some nursing homes where you've got 3 and 4 residents in a room.
Mm-hmm.
Now, that is a recipe for, and this isn't just COVID, right? This is if there's a flu, if there's any kind of infection, you're living in communal living. So I think that this is going to be a time of innovation that we revisit. Is that humane? Is that good for us to have 3 and 4 people? We don't even do that to college students. So I think, can we give residents more privacy? If you noticed, and a lot of people don't know the difference between assisted living and nursing homes, assisted livings, everyone pretty much has their own apartment. And
right.
So you did not see the kind of transmission with assisted living. It was very, very different. So I think I like to hope that we're going to see a lot of innovation in the way we're constructing, maybe the way that Medicare and Medicaid are reimbursing, giving residents more dignity, more privacy. I think we're in a tough position right now because what happens, it's interesting, different, talking to people that work in hospitals versus people that work in nursing homes and assisted livings. People in hospitals are trained to deal with infectious diseases like COVID. They've worked with people who have had TB. They've worked with people who have had all kinds of really easily transmittable diseases. They know what they're doing. Nursing home and assisted livings, they were not prepared for this in any way. And especially these states where they put all these residents back in nursing homes that were ill. I feel like the nursing home industry's gotten a really, really bad rap lately. Mm-hmm. But they didn't have the training. They didn't have the training, and they didn't have the equipment that they needed either.
Yeah. Well, I know the one thing where the facility I wanted putting my parents into, or they were my parents for all since I keep saying it, they were my grandparents. Mm-hmm. But the thing of it is that the facility, which was the only one available at the time, kept changing the names. It was owned by one of the hospitals. They kept changing names, and the people who worked there really did not enjoy their job. So, I mean, that was another issue we always had to put up with there, and which never made it easy.
And so, and I don't want to make you did what you had to do.
Yeah.
You did everything. But I would suggest if someone's listening and they say, there's a place where the staff don't seem to enjoy their jobs, I would say that's a place you probably don't want your loved one, because and of course I don't want to make you certainly you did the best you could.
You're not going to make me upset by that, because the thing of it is when you first go in there, everything seems to be really copacetic and everything's fine, hunky dory, whatever you want to call it. And then when after about a couple of weeks to a month or 2 months in, you see some things are not too kosher here. So,
well, I think I have a whole chapter in Cruising Through Caregiving about how to determine how to determine like what you want in a place that you're going to bring your loved one to. And again, some people listening might be saying, well, I never want to bring my loved one to a community like that or a nursing home, and that's fine. But if you do get to a point where that is, I think you have to have a wish list of, like, what are your non-negotiables? Like, what are the few things that you're saying, this is absolutely necessary in order for me and my loved one to be comfortable?
Hey, Jennifer, before we let you go, is there anything else we should know about this during coronavirus times? And if you would, tell us about a little more about the book and where we can find that if we'd like to find that. If there's someone
absolutely.
Listening.
So cruisingthroughcaregiving.com, you can download the first chapter for free, and you can download all the worksheets. But it's in local libraries, Amazon, Barnes & Noble, so cruisingthroughcaregiving.com. The other thing that I would say right now is, during COVID, just be easy on yourself. This is a really, really tough time. Just do the best that you can. I think for those people who are saying, you're quarantining with your loved one, you're not letting other people help, I think you need to do a risk-benefit analysis if you're not letting others help. I understand that there's a lot of advice to say social distance and all that. I get that for sure. However, home care agencies are still sending staff out. If you have friends and family that want to help you during this time, do a cost, kind of a cost-benefit analysis in terms of what's your risk tolerance? Like, are you okay letting some people into your home to help out with your loved one? Because in a lot of ways, I think isolating yourself and your loved one during this time, even though that's what we're being told to do, it can be really bad for your mental health, for your loved one's mental health, and if you're not accepting help, I think that that's also going to lead to burnout. So I think just, yes, you want to be mindful of the social distancing thing, but you got to think about what's the lesser of two evils, if that makes any sense.
Mm-hmm. Jennifer, we sure appreciate your time
this
morning.
Yes, very much so. I appreciate it very much.
And all your
Thank
positive
you. Have
words.
A great day.
You too. You take care.
All right. Thank you so much, Jennifer FitzPatrick. We'll come back with more Party Line next on WILO.
Here